Okay, so today we'll talk about the skeleton. You already know that human skeleton consists of two parts, axial skeleton and appendicular skeleton. Okay. So first we'll talk about axial skeleton or axial part of the skeleton. In this part, we'll talk about the bones of the axial skeleton. We'll see what are the bones present in the axial skeleton. Then we'll talk about the cranial bones individually and facial bones. And then we'll talk about the bones of the thoracic case and vertebral column, and a couple of abnormal conditions related to the axial skeleton. Okay. So first, in the axial part of the skeleton, we have total 80 bones. And you already know that axial skeleton consists of the skull, thoracic case, and the vertebral column. Okay? So the bones of the skull, bones of the thoracic case, and the bones of the vertebral column together form the axial skeleton or axial part of the skeleton. Okay? So here you see like two different colors. They have shown the axial and appendicular skeleton. Blue colored part is the axial skeleton, and yellowish color, that's the appendicular skeleton. So first we will talk about the skull bones. The skull has two groups of bones, cranial bones and the facial bones. Okay? So skull has two groups of bones, cranial bones and facial bones. Cranial bones form a cavity that is called the cranial cavity, in which the brain is located. So, cranial bones form the cranial cavity in which the brain is located, and these bones protect and support the brain. Okay? Facial bones form the framework of your face. So the framework of the face is formed by the facial bones. There are total 8 cranial bones present in the skull. How many? 8. And there are 14 facial bones are present in the skull. So 8 cranial and 14 facial bones.
You're saying 14?
1, 4.
Okay,
Yeah,
thank you.
14. Okay. Facial bones form the framework of the face, number 1. It also has few other important features. There are cavities inside the facial bones, and those cavities contain important sensory organs. So we can say that facial bones form a number of cavities, and within those cavities some important sensory organs are located. For example, the orbital fossa is formed by the facial bones here. That contains the eye. Nasal cavity is formed by the facial bones. So you know that the sensory receptors, smell receptors are located in the nasal cavity. Oral cavity, that's the mouth, is formed by the facial bones. Where the tongue, the taste organ, is located. So we can say that facial bones form a number of important cavities where some important sensory organs are located. Facial bones form the openings for air and food passage. So we know that we pass the food through the mouth, oral cavity. We take the air through the nose. So those cavities are, or passages are formed by the facial bones. Support the teeth and facial muscles. So you know that teeth are supported by the facial bones and facial muscles are attached to the facial bones. Facial muscles are tiny, many tiny muscles are attached to the facial bones, and those muscles help in what? Expression, facial expression. When you get angry, right? When you are happy, your facial expression changes, right? So those expressions are given by the facial muscles, and those tiny facial muscles are supported by the facial bones. So we will see the cranial and facial bones. You see they have shown those two groups of bones from the side. So there are 8 cranial bones. What are those? Frontal bone, we have one in the forehead area, that's the frontal bone. And at both sides of the skull, we have parietal bones. So 2 parietal bones. Then in the back, you have the occipital bone. We have one occipital bone. Then below the parietal bones, around the ear, you have the temporal bones. So you have 2 temporal bones close to the ear. And one sphenoid bone, which is a butterfly or flying bat shaped bone you have seen when you took off the upper part of the skull and saw the floor of the cranial cavity. You have seen that butterfly shaped bone. That's the sphenoid. Okay? It forms the floor of the cranial cavity. And then ethmoid bone. Most part of the ethmoid bone is inside the nasal cavity. So you can only see a small part of the ethmoid bone from outside. So those are 8 cranial bones present in the skull. So this is the front view of a skull, and you can see the frontal bone clearly because it forms the forehead part and front part of the skull, the yellow one. And behind the frontal bone, in both sides, you have parietal bones. So these are parietal bones, and below the parietal bone, you have the temporal bones. So these are temporal bones. Okay? And occipital is in the back, so you don't see the occipital here. And I said that sphenoid is in the floor of the cranial cavity, so you have to really open the skull to see the sphenoid. And small part of ethmoid you can see from the front. This is the ethmoid, small part of the ethmoid bone. Most part is located inside the nasal cavity. Okay. Now, if you see from the side, you can see the parietal and temporal bones more clearly. So this is the frontal. Behind the frontal you have parietal, and this is the temporal, and this is the occipital. Now, the joining of those cranial bones are done by sutures. So sutures are the joints of the cranial bones. So we will try to see important sutures present in the skull. It is important for your lab too. You know, this lecture is also very important for your lab because you will see these bones in the lab. Okay, so coronal suture. Coronal suture is this one that connects the frontal and parietal bones. Okay? Then squamous suture connects the parietal and temporal. So you see squamous suture that connects the temporal and parietal. Lambdoid suture connects the parietal and occipital. There is another important suture that you don't see that is present in the midline that connects two parietal bones. That is called the sagittal suture. So you don't see the sagittal here, but you will see when you see the skull in the lab, you will see that sagittal suture. Okay? So those are the sutures, very important. I will definitely ask them either in your lecture or in your lab. So you will get it, okay, in your exam. Okay, so which bones join to form which suture, or I can ask that this suture connects these two bones. Okay. Okay. Now we will see the fascial bones. We have 14 fascial bones, as I have mentioned already a couple of times. So from the side, you can see some of those fascial bones. The lower jaw bone is the mandible, okay, and upper jaw bone is the maxilla, and lower teeth get attached to the mandible, and upper teeth get attached to the maxilla. Okay. Then the cheekbone is the zygomatic bone that forms the prominence of your cheek. Okay, so that's the zygomatic bone. And the bridge of the nose here is formed by the nasal bones. You see the nasal bone, the blue one. The bridge of the nose is formed by the nasal bone. And then behind the nasal bone, you have a part of the maxilla, and then behind that part of maxilla, you have another bone that is called the lacrimal bone, the green one, lacrimal bone. Okay. So those fascial bones you can see from the side. Here you can see the sagittal suture that I did not show you in last picture. The sagittal suture you see from the back. Two parietal bones join to form the sagittal suture. Okay? And you can see the lambdoid suture clearly here. Okay? If you look the skull from below, from bottom, this is the bottom view of the skull. Okay? So here you can see a number of foramen or opening at the bottom of the skull, and those openings are mainly for the nerves and blood vessels. Some important blood vessels enter into the brain through some of those foramen, and cranial nerves, important nerves, also exit from the brain to the foramen. So just know that those foramen are to let the nerves or blood vessels pass through them. Okay. You can see the sphenoid bone here, the red one, butterfly shaped bone, that's the sphenoid bone. And as I have mentioned, that it forms the floor of the cranial cavity. So that. And here the largest foramen is present in the occipital bone. You can see that largest foramen, very large, is called foramen magnum. Magnum indicates large, okay, magnum. And spinal cord gets out from the brain through the foramen magnum. Okay, now I'll just go over few important cranial bones first, individually. First, you see, this is the temporal bone. Temporal bone has a flat bony part. You see, the upper part is just a flat bone. This part is called the squamous part. The flat bone part, that is the squamous part. In the lower part of temporal bone, you have a number of structures. What are those structures? You have 3 processes. How many? 3 processes. The sharpest process, very pointed, that is called the styloid process, going downwards. That sharp process. And then you have a blunt process that is not sharp, more round. That process is called the mastoid process. Mastoid process, actually you can feel behind your ear. If you press, you can feel the elevation, the round part. That's that bony part. That's the mastoid process. And sometimes when you get ear infection, if you press the mastoid process, you'll feel pain. And that is one way that doctors can detect or diagnose if someone has inner ear or middle ear infection. Okay? So just know that this is a way to diagnose the ear infection. Another is you will see the doctor will pull your ear lobe like this. Okay? So those are 2 ways you can diagnose. Anyway, so those 2. And another process that is directed forward towards the zygomatic bone, that is called the zygomatic process of the temporal bone here. You see, this is the sharp one, that's the styloid process, and this is the mastoid process, and this part or process is going towards the zygomatic bone. That's why this is called the zygomatic process of the temporal bone. Okay? Zygomatic, yes, you can actually feel that. Those three processes. Then you have a canal that is called external acoustic meatus. You know that canal-like opening is meatus. So that's the external acoustic meatus or outer ear canal. So that's the temporal bone. Sphenoid, the butterfly or flying bat shaped bone is the sphenoid bone. If in the test I ask you the shape of which bone is like a butterfly or a flying bat, that's the sphenoid. Okay. Okay. Now this is my favorite bone. I don't know why. Okay. So probably I worked with bats for a few years. At WashU I did echolocation research on bat brain. I used to work with bats, probably that's why I like this shape. Okay, so you see it has a body in the middle and 4 wings, 2 greater and 2 lesser wings. Greater wings are larger and lesser wings are smaller. So these two are greater wings and these two are lesser wings. And this is the body part. Okay. Now, on the body, you have a fossa. Fossa is a basin-like depression, you know that, on the bone. So, a fossa is present on the body part, and that fossa is called the hypophyseal fossa. Depression like this, okay? And hypophysis means pituitary gland. So hypophyseal fossa is the fossa for the pituitary gland. So pituitary gland just sits on the hypophyseal fossa, on the body of the sphenoid. Okay, pituitary gland is located there. I may ask you this question, any of these, what I said, how many wings, butterfly-shaped bone is the sphenoid, on the body, which fossa I will see, that's the hypophyseal fossa, and that contains what? The pituitary gland. Okay? So those are the important things in this bone, the important parts of this bone. Okay, then the ethmoid. Ethmoid bone has a middle part and two lateral muscles. So, two lateral muscles. This is one lateral mass, this is another lateral mass, and a middle part. Now, the middle part is like, this vertical, and the part that is going upwards beyond the bone, beyond the main part of the bone, that is called crista galli. So the middle part is like this, and this is the crista galli. Okay, this part. And the bottom part is going downwards like a plate of bone inside the nose, and that is called the perpendicular plate of ethmoid. So you see the middle part here, and the part is going upwards, that's the crista galli, and the part is going down like a flat bone, piece of bone, that is called the perpendicular plate of ethmoid. And that part is actually separating the nasal cavity, going down like this, a plate of bone, and separating the nasal cavity. Another information is in the lateral muscles you have many hair cells or tiny sinuses. You know that sinuses are the cavities. So hair cells or sinuses. Air cells or sinuses. Hair cavities or sinuses. This is the floor of the skull. If you remove the upper part of the skull and see the floor, you see this is the sphenoid, butterfly bone. Okay? And this is the frontal bone, this is the temporal bone, this is the occipital bone. Now, this part is the uppermost part of the ethmoid bone. As I have mentioned, that ethmoid is mostly inside the nose, so you don't see the most part of it, but a small part you can see. So you can see here the upper part of the ethmoid bone. Two important structures you can see here. One is cribriform plate. You see many holes are present in the cribriform plate. So many holes or pores are present in the cribriform plate. And you can also see the crista galli. You remember I said that middle part of ethmoid has upper part that's going upwards, that's the crista galli. So that crista galli you can see here. So this is crista galli, and the cribriform plate. Plate has many holes. Those are called olfactory foramen. Olfactory foramina. Olfactory nerve fibers pass through it. Olfactory nerve fibers carry smell, you know that, from the nose and go to the brain through those holes. So that's the floor of the skull. Now we'll talk about the facial bones. We have 14 facial bones. What are those? We have one mandible, two maxillary bones. Actually, maxilla is one, but maxilla is formed by the fusion of two maxillary bones. Okay? They meet at the midline, fuse at the midline, and form the maxilla. The maxilla has two maxillary bones. Then we have two zygomatic bones or cheekbones. We have two nasal bones. This is the bridge of the nose, but the bridge is formed by two tiny nasal bones. Okay? And they join and form the bridge like this. Okay? Then we have two lacrimal bones, two palatine bones, one vomer, and two inferior nasal concave. So those are the 14 facial bones. Just know that I will ask the question in a way that will be easier for you. That if I ask you that palatine bone or vomer, those are cranial bones or facial bones, that kind of question. Okay, so just go over the names a couple of times, then that should be fine. And if you know the 8 cranial bones, then others are facial bones. Okay? So you should know the name of 8 cranial bones, and you know that by now. Mandible. Mandible is the lower jaw bone, and this is the largest and the strongest bone of the face. Remember, if I ask you which one is the largest and the strongest bone of the face, this is the mandible. Also, mandible is the only movable bone of the skull. You can move the mandible, and that's the only bone of the skull that you can move. Other bones are fixed. And mandible moves at temporomandibular joint. This is the joint, temporomandibular joint, or TMJ, you probably have heard. The bone moves here. Temporal bone and mandible, temporomandibular joint. Okay, so strongest and largest, only movable bone form the lower jaw, and only movable bone moves at temporomandibular. So this is the picture of a mandible. First, the mandible has two parts. This part is called the body, and this is the arm-like part of the mandible, that is called the ramus. You know that ramus is the arm-like structure of a bone. So mandible has a body and a ramus. Now, on the body of the mandible, the lower teeth are attached. So teeth are attached on the body of the mandible. And in the ramus, you have two structures. Mandibular condyle, the round structure, and coronoid process. So So in each ramus you have a mandibular condyle and a coronoid process. Mandibular condyle fits in the mandibular fossa of the temporal bone and from the temporomandibular joint. So this part, the condyle part, articulates with the temporal bone. Okay. Coronoid part or coronoid process is free. It is not attached to anything. Okay. Now there are two pairs of foramen in this bone, mental foramen and mandibular foramen. Mental and mandibular. You see, you know that this part of the body is called the mental part or mental area. You have learned that before. And that's why the foramen are called mental foramen, present in the body part, right? And if you see inner surface of the ramus, inside the ramus, you see a foramen in each ramus, that is the mandibular foramen. So in the front of the body you have the mental, and the inner part of the ramus you have the mandibular foramen. Okay. Maxillary bones. Two maxillary bones fuse to form the maxilla. And yes,
What were the two parts of the ramus again? Like the two structures?
condyle and coronoid process. You can see in the picture mandibular condyle and the coronoid process. You see this picture on the projector. Mandibular condyle and the coronoid processes.
And then through the foramen, would you say that nerves and blood vessels, is that what would come through there as well?
Yes, nerve and through the mandibular foramen, duct, salivary gland duct pass. Okay. So, did you get those two parts? Okay. Two maxillary bones fuse to form the maxilla, and maxilla is the upper jaw bone, where the upper teeth are attached. And maxilla has couple of important things. One is inside the maxilla, the largest sinus is located. The largest sinus is called the maxillary sinus because it is inside the maxilla. Okay, so the largest sinus or cavity is present inside the maxilla, that is the maxillary sinus. And you know that often sinusitis occurs. It's a clinical condition, very commonly heard. Mostly that happens in the maxillary sinus. And sinusitis is inflammation of the sinus. And when inflammation occurs, the cells secrete fluid and those cavities get filled with fluid. So you feel heaviness of the head, you feel pain, okay? Those are the symptoms. Okay, now, so if I ask you upper jaw bone is what? That's the maxilla. And if I ask you the largest sinus is which one? That's the maxillary sinus inside the maxilla. And if I ask you the keystone bone is the maxilla. Why it is called the keystone bone? Because maxilla is in the center of the face, and almost all facial bones get attached to the maxilla. So maxilla is sitting in the middle of the face and holding other facial bones together. Okay, so that's why it is called the keystone bone. Except the mandible, all other bones get attached to the maxilla. Only mandible is not attached to the maxilla. Okay. So, did you get it? What I said? So, it is called the keystone bone. Why? It is sitting in the middle of the face and holding all facial bones together, except which one? The mandible. Okay. This is the maxillary, one of two maxillary bones, and it has two processes, extensions, bony extensions. One is going upwards towards the frontal bone. From here it's going upwards towards the frontal bone. That is called the frontal process of the maxilla. Very easy, because it is going towards the frontal bone, that's why it is called the frontal process. Another part is going towards the zygomatic bone. You see here, this part is going to the zygomatic bone. That's why this part is called the zygomatic process of the maxilla. Okay, it's going to the zygomatic bone, this part. That's why it is called the zygomatic process. This part is going to the frontal bone. That's why it is called the frontal process of the maxilla. So in the test, if I ask you which one is the keystone bone, that's the maxilla. It articulates with which bones? All facial bones, except which one? The mandible. And the largest sinus is the maxillary sinus, right? And upper teeth get attached to the maxilla. Zygomatic bones are also called cheekbones. And the zygomatic bone form the infralateral margin of the orbit. We know that this is the orbit, so this is the zygomatic bone. You see, you can say that inferior and lateral margin. Inferior means below and lateral side. The margin of the orbit is formed by the zygomatic bone. Nasal bones form the base of the nose. Lacrimal bones contain lacrimal fossa, in which the lacrimal sacs that contain the tear is located. Okay, so you know already, you know these bones. Here you see the lacrimal sac, the fossa of the lacrimal bone, where the lacrimal fossa, where the lacrimal sac is located, that contains tear. Palatine bones and vomer. Those bones are located inside the nasal cavity, so we don't see those bones, but if you see inside the nose, you see this is the nasal septum. Nasal septum is the partition between two halves of the nose. Okay, the septum that separates the nasal cavity into two halves. And you see that the upper part of nasal septum is formed by the perpendicular plate of ethmoid. You remember the ethmoid bone? I told you that a vertical middle part is like this, and upper part is called the crista galli, and lower part is called the perpendicular plate of ethmoid, that is going to the nasal cavity and separating the upper part, forming the upper part of the nasal septum. So this is actually that perpendicular plate of ethmoid. And vomer forms the lower part of the nasal septum. So the lower part of nasal septum is formed by the vomer. So that partition that separates the nasal cavity is formed by two bones. Upper part is by the ethmoid and lower part is by the vomer. And then in the front you have a cartilaginous part. You know that you can move your nasal septum like this because it has a cartilaginous part in the front. Okay. sometimes you know that deviation, septal deviation occurs. That means that your nasal septum should be straight like this in the middle, but if it moves to one side or bend to one side like this, that can block the one side of the nose. Okay, then you have to fix that. Now we'll see the important press hard.
Well, I have like little balls on the tip of my nose. Like, what are those?
That's the soft tissue.
The soft
That's
tissue.
not the septum. Okay. Sometimes in some locations in our body, soft tissue accumulates most and form like round, soft structures. Okay, then we'll continue on the axial bones. We'll see the sinuses, we'll see the hyoid bone, we'll see the vertebral column, and then we'll talk about a couple of clinical conditions. So sinuses are air-filled cavities inside the bones. And you know that most of the sinuses are present in the facial bones. Okay? And sinuses help in few things. Since the facial bones have sinuses, the sinuses make the whole skull lighter, decrease the weight of the skull, enhance the sound. It improves the quality of sound. Just know that that is the another function. What are the bones that have sinuses? We have sinus in the frontal bone, we have sinus in the sphenoid bone, in the ethmoid bone, and maxillary in the maxillary bone. And maxillary sinus is the largest one, as I have mentioned. But you have also sinuses in the frontal bone, sphenoid bone, and ethmoid. In case of ethmoid, you have already seen those sinuses. You remember ethmoid has a middle vertical part, and in both sides you have lateral masses, and I showed you at that time that air cells or small air sinuses are present in both lateral masses. So those are the ethmoidal sinuses. So here you see the location of the sinuses. The largest ones are the maxillary. Hyoid bone. This is the hyoid bone, and hyoid bone is a lonely bone. Okay, this is a lonely guy. Why? It is lonely because hyoid bone doesn't have any bony attachment. No bones are attached to the hyoid bone. Then the question is, if it is not attached to any bone, then how it is located here? How it is held here? It is held by ligaments. So ligaments hold the hyoid bone in the front of the cervical vertebra, front of the neck. So that is one reason it is called the lonely bone. No one wants to touch it. Okay. Number two, no one wants to take this bone as its part. Like, for example, when we talk about the skull bones say, no, he is not our part. When we talk about the vertebral column says, no, he is not our part. Okay? Got it? So it does not belong to any group of bones. So that is another reason. Now, although it is a lonely bone, it has a couple of important functions. The anterior neck muscles. Most of the anterior neck muscles are supported by the hyoid bone, because it makes sense, because you know that anterior neck muscles are like this, going like this, so they are supported by the hyoid bone. And anterior neck muscles perform two very important functions. One is swallowing of the food. When you swallow the food, that is number one. And number two, when you make sound, production of speech. So those muscles are supported by the hyoid bone. Muscles of speech and the muscles of swallowing. Okay. Now, the parts of this bone. This bone has a body and two greater horns and two lesser horns. These are lesser horns, lesser means smaller, and these are greater horns. In case of sphenoid, you have seen wings, greater wings, lesser wing. In case of hyoid, you see the horns. So from hyoid, basically, a couple of questions. One is, if I ask you which bone is called the lonely bone, that is the hyoid bone. Another is the muscles, anterior neck muscles, the muscles of swallowing of food and the speech production, those are helped by, supported by the hyoid bone, right? And for the lab, if I put the hyoid bone on the table and ask you identify this bone, you should be able to identify the hyoid bone. Okay? So I may ask in the lab part that identify this bone. That's all. Vertebral column. Vertebral column transmits the body weight from the trunk to the lower limbs. This is the vertebral column, and from the upper part of the body, the weight is given to the vertebral column, and then vertebral column transmits the body weight to the lower bones of the body. Then another important function is vertebral column protects the spinal cord. It protects the spinal cord because we know that spinal cord is located in the vertebral canal. That canal is formed by the vertebrae. So those two are very important functions given by the vertebral column. So we have different groups of vertebrae in the column. What are the different groups of vertebrae? The upper seven vertebrae are called the cervical vertebrae. Then next 12 vertebrae are called the thoracic vertebrae. So we have 7 cervical, 12 thoracic, and then below the thoracic we have 5 lumbar. So in the middle, in between the cervical and lumbar, you have thoracic. And thoracic is 12, cervical is 7, and lumbar is 5. So if you add 7 and 5, cervical and lumbar, that makes 12. So 7, 12, 5. Then we have a large triangular bone, that is the sacrum. So below the lumbar vertebrae, you have the sacrum. Sacrum is actually, in very early life, sacrum is separated into 5 pieces of sacral vertebrae, and eventually they fuse together. 5 sacral vertebrae fuse and form that triangular shaped sacrum. Okay? So in early life, sacral vertebrae are 5 and they are separate. And then we have the tail bones. Those are called coccyx, and coccyx are 3 to 5 tiny pieces of bones. So some people have 3, some people have 4, some people have 5. It's not fixed. Okay? So it can vary. The number can vary. So that's the vertebral column. Now, the bodies of vertebrae are attached to each other by a disc of cartilage. That is called intervertebral disc. So, intervertebral discs attach the bodies of vertebrae. And intervertebral disc is formed by fibrocartilage. You remember when I talked about different types of cartilages, I said that symphysis pubis. This is the symphysis pubis. 2 hip bones are attached by symphysis pubis, which is a fibrocartilage, and also intervertebral disc is a fibrocartilage. So in the test, I will ask this question to you. Okay? If I ask you that intervertebral disc is formed by which type of cartilage? Fibrocartilage. How about symphysis pubis or pubic symphysis fiber? How about your ear? Elastic. Good. How about articular cartilage in the joint? Hyaline. You remember when I talked about the ossification? In a couple of places, the hyaline cartilage will never be converted to bone. One is the articular cartilage and epiphyseal plate. Right? So, how about your respiratory tract? Fill out. What type of cartilage?
The epiglottis, is that what you said?
No, respiratory tract, like trachea, larynx. How about costal cartilages?
That's, area,
Hyaline, right? How about fetal skeleton? Hyaline. Most of the cartilages are hyaline. I'm repeating again. You have the note I mentioned in previous lecture. So, where you will find the hyaline cartilage? Fetal skeleton. In your respiratory tract. Joint or articular cartilages. Costal cartilages. Right? All those are what type of cartilage? Hyaline. Intervertebral discs and symphysis pubis. Those are what? Fibro. How about your ear? That one everybody knows. And also epiglottis is elastic. So remember E, epiglottis starts with E. So that is elastic cartilage. So your ear, both start with E, right? Your ear and epiglottis. So that elastic cartilage.
What's reticular then?
Articular is the joint, so it's hyaline.
Reticular.
Reticular is not a cartilage. What are the 3 types of cartilages? Hyaline, fibro, elastic. Reticular is loose connective tissue. What are other loose? Reticular, adipose, areolar. Okay. So yeah, at the beginning it will be kind of, you will mix them up, but make sure that 3 types of loose: adipose, areolar, reticular. Okay, that's all. 3 types of cartilages: hyaline, fibro, elastic. You have to keep them separate. If you mix them, then you will get confused. Okay? Keep them separate in your brain. In 2 different places in your brain. Keep them. Okay. Now, so remember, I will ask a couple of questions that which structure is formed by which type of cartilage. Now you should. Okay, now intervertebral disc has 2 parts. The inner part is called the nucleus pulposus. Remember, nucleus, when we say nucleus, we usually indicate the center, right? So the center part is called the nucleus pulposus, and outer part is called annulus fibrosus. Annulus means around. Okay, so annulus fibrosus is the outer part. nucleus pulposus is the inner part. And nucleus pulposus is very soft, like jelly-like structure. And outer part, annulus fibrosus, is formed by fibers, and that's why it is tough and strong. Any structure formed by fibers is tough and strong. Okay? So here you see the intervertebral disc, and you can see the nucleus pulposus, and the fibrous structure is annulus fibrosus, which is the outer part. So if I ask you that inner part is what, outer part is what, those are the two parts. Now, sometimes what can happen if pressure falls on the vertebral column, lot of pressure falls on the vertebral column, what can happen, the disc, intervertebral disc can slip out. If that happens, if the disc slips outwards, that is called slipped disc or herniated disc. Slipped disc or herniated disc. And you see in this case, this side is normal location, but this side, part of it has pushed backward. So in one side, the disc has been pushed backward. And yes,
How does that happen again?
if a lot of pressure falls on the vertebral column. So that is called what? Herniated or slip disc. And that is a problem. What problem might occur, usually occurs, is you see that these are the spinal nerves get out from the spinal cord, and when the disc slips out, it presses the spinal nerve, and that can cause pain, severe pain. And in that case, you have to move it back to its position. The term hernia we use in everywhere in our body. You have heard probably herniated inguinal hernia. Have you heard that? Inguinal hernia. Some of you have heard, just commonly heard, inguinal hernia. Any organ or structure of the body, when it moves from its normal position to abnormal position, that is called hernia. If your eyeball pops out, that is hernia, herniated eyeball. If your intestine moves from its position to a different position, we say herniated intestine. So hernia is the movement of an organ from, or part of the organ from its normal position to abnormal location. That is hernia.
So what moves when lots of guys get the inguinal one?
If it happens both in male and female, more in male. You know that the spermatic cord is here, and it is located inside a canal that is called inguinal canal. Yeah, inguinal part, inguinal canal, and this is the spermatic cord. Okay, so if you carry a lot of weight, then what can happen slowly? The spermatic cord can tear the wall of the inguinal canal. Canal is actually a membranous canal, so it can tear like this and can get out, like this. So that's the inguinal hernia.
So that's why like here, like if they see a bulge, then they know that like you have like.
You can feel actually
Yeah,
if you
because it comes
from the
maybe-
surface, because inguinal canal is very superficial, just under the skin. Okay,
Okay.
so you can actually feel that the spermatic cord has came out. Okay, so the vertebral column is formed by vertebrae, and you know that different groups of vertebrae, and in between the vertebrae you have intervertebral discs. We have talked about intervertebral discs. Now we'll see the structure of a typical vertebrae. So a vertebrae has a body, and rest part is called the arch. So this is the body, and rest part is called the vertebral arch, A-R-C-H. Anyway, the arch has a number of processes. What are those? One spinous process that is going backwards. So you see the spinous process directed backwards, going backwards, and the body is in the front. Okay. So one spinous process, two transverse processes going sidewards like this, lateral. So one spinous process going backward, two transverse processes, and then two superior articular processes going upwards, and two inferior articular processes going downwards. Okay? So those are the processes. Spinous process, two transverse processes, two superior articular processes, and two inferior articular processes. And if this is the vertebrae, these are superior articular processes, and it also has inferior articular processes. So superior articular processes of the vertebrae below will articulate with the inferior articular processes of the vertebrae above. So they will connect like this. Okay? This is the inferior of the vertebrae above. This is the superior of the vertebrae below. So they will get attached like this. Okay? Yes.
In the lab book, it said one of them like articulate with the ribs or something like that.
Only in case of thoracic, because you know that ribs are, I have shown you in last lab to some of you, that ribs are present in the thoracic part, right? So what happens, you see here, that ribs are going back like this, and these are the transverse processes. So the ribs get articulated with the transverse process as well as at the side of the body of which vertebrae? Thoracic vertebrae only, because ribs are only present in the thoracic. So ribs get attached to the transverse process and the body of the side of the body of the thoracic vertebrae. That's why you will see facets, flat articular surfaces are present in those two structures. You see here, this is a thoracic. How you know? You see, this is the facet for the rib. As I said, that at the side of the body. You have. Also, you have facets in the transverse processes. You see, these are the transverse processes, and we have facets. So this is definitely thoracic vertebrae. The rib will get attached to those two structures. Okay. So how many cervical we have? 7. And out of those 7, first and second cervical, they have their own names. First cervical is called the atlas. Why it is called the atlas? Because the whole globe is the skull, sits on the atlas, and can, just know that the whole globe, that's the skull, sits on the atlas. And atlas is very easy to identify because it does not have any body. No body is present in the atlas. Since there is no body, when you see the bone, you'll see a huge vertebral foramen here, because the body, if there was a body here, then the space will get smaller. Since there is no body, the opening is very big. Okay? So that's the atlas. And axis is the second cervical vertebrae, that is called axis. And why it is called axis? Because if you see the axis, you will see a finger-like extension going upwards. That is called the dens. From the body of the axis, you will see a structure is going up like this, and that is called the dens. And this is the atlas here. So the atlas can move like this around this dens. Like this. Okay. So C2 is the axis. So if you see the dens, that is axis. Here, and other 5 cervical vertebrae, they are very similar to each other. So it is difficult to separate them. They look similar to each other, other 5s, and they don't have their individual names. Now, how will identify a cervical vertebrae? How will separate the cervical vertebrae from thoracic and lumbar? I have shown you in the lab. I'm repeating again. Very easy. Spinous process is divided. So if you see the end of the spinous process is divided, that's the cervical. Another point to make sure, transverse processes have transverse foramen. So if you see those two things, that is definitely a cervical vertebrae. Okay. And the body is small, but small or large, that's a relative term. If the whole skull is small, then of course thoracic vertebrae could be also small. So those are the 3 points. First, spinous process is divided, transverse foramen are present in the transverse process, and then after you make sure those 2 things, then you can see the size of the body, that is small. This is an atlas C1, cervical 1, and you see no body, so therefore this opening is very deep, very large, because no body is here. Okay? And in atlas you have 2 arches, it's like this. You know, you have seen the centris arch, right? So 2 arches, anterior and posterior. 2 arches. Okay? So posterior arch is the larger one, anterior arch is the smaller. So the smaller one is the anterior arch, larger one is the posterior arch. I will not ask that which arch is bigger, which arch is smaller. I will ask you that how you will identify an atlas. It has no body, right? And it has how many arches? 2 arches. Okay, anterior and posterior. This is the axis, C2. You see the dens, although you are looking from the top, that's why dens is not very, you can see the height of the dens. It's pretty clear, bony extension. Now you know that this is C1 like this, and C2 is like this, and the dens goes inside part of C1. And your spinal cord, very important organ of the body, passes through the vertebral canal. So that's the weak point in our body. Why? If you hit C2, what can happen? It will move back, right? And your spinal cord is here. Just think that your spinal cord is here, and if you move the C2 back, then the dens will move back and will crash the spinal cord. That's a very weak point and could be dangerous. Abnormal conditions of vertebral column. Sometimes, developmentally, we may see abnormal bending of the vertebral column. What are those abnormal bendings? Scoliosis, kyphosis, and lordosis. Scoliosis is sideways, lateral bending. So if you see the person is like this, that's the scoliosis, lateral bending. Kyphosis happens in the upper part of the vertebral column, in the thoracic part of the vertebral column. What happens? The bending occurs like this. Okay? So the person's upper part will be forward like this. Okay? So that's the kyphosis. And lordosis is a forward bending like this of the lower part of the vertebral column. Usually happens in the lower part. Kyphosis usually happens in the thoracic part. Just know that lateral sideways is the scoliosis. If the upper part of the body is forward, that's the kyphosis. And if the lower part is like this forward, that's the scoliosis, lordosis. Yes.
Can you have like two of them?
You can have two of them. Yes, you can have two of them. And remember that have you seen that cartoon movie Hunchback of Notre Dame? Yeah. So who is the character? Quasimodo, right? Quasimodo had what? Kyphosis. Remember, okay? So if you remember that, it will be easy for you. Quasimodo is like this. So kyphosis, lordosis, and scoliosis.
Is lordosis what some people call having a spray back? Because it goes
Yeah,
way-
we commonly use that term. Okay. Another serious clinical condition that is called spina bifida. Spina bifida is a condition in which what happens when the vertebrae is formed, the ossification, ossification starts from 2 points, and 2 halves of vertebrae are formed separately, like one half and another half of the vertebrae. And finally, they fuse like this and form the spinous process like this. So now, if that fusion is not complete, what can happen? It will still make sense? It will not form the spinous process, it will not fuse and form the spinous process. In that case, a gap will remain in the back, and the covering of the spinal cord, that is called the meninges, or both the covering and the spinal cord can come out through that open space, and either can happen. Which one is dangerous? If both comes out, right? If the spinal cord comes out, that's dangerous. But if only the covering, that's not that dangerous. So here you see that both the meninges and the spinal cord have come out, and that is called meningomyelocele. And if only the covering, that is the meninges, comes out, that is called meningocele. So meningomyelocele and meningocele are those 2 types of spina bifida. Spine bifid. Make sense? Divide. Spine should be 1, but if the fusion doesn't occur, then spine will remain divided. That is the spina bifida. So if I ask you in the test that how many cranial bones we have? How many cranial bones we have? 8. You need to know which one is what. So the forehead, that's the frontal. In which one you have the largest foramen? Foramen magnum, the occipital. Which one is butter shaped, butterfly? Sphenoid. On the sphenoid, body of the sphenoid, you have what? Hypophyseal fossa, right? Hypophyseal fossa. It contains what? Pituitary gland. And how many wings the sphenoid has? Two or four? Four. Two greater, two lesser.
Where's the pineal gland in the head?
Pineal in the brain, it's not related to the skull.
okay.
It is in the brain. When you dissect the brain, you'll see the pineal gland. Okay?
But there's no like cavities in
No. Okay. Now, if I ask you that, tell me the strongest and largest bone of the face. That's the mandible, right? And keystone bone is what? Maxilla. Largest sinus is what? Is the sinus. Only movable bone of the skull, mandible. Okay. So I can think. So lonely bone. Okay. So how many cervical you have? 7. The first one is what? Atlas. It doesn't have any body. It has 2 arches, St. Louis arch. It has 2 arches, right? Dens is what? Present in the C2, right? So an extension going up like this, present in C2. For the lab, if I put a thoracic, lumbar, cervical, C1, C2, you need to identify which one is what, right? So different parts of a vertebrate. Those are the few questions that could be in the lecture exam. Those are the type of questions I must be. Okay. Lordosis, kyphosis, scoliosis, spina bifida, intervertebral disc, different types of cartilages. Okay, so remember those. Okay. Now we'll talk about that. So we are done with the axial, and rest of the bones, some other important bones you will learn in the lab. So now we'll talk about the appendicular skeleton. Appendicular skeleton consists of the bones of upper and lower extremities. Okay, so in the appendicular skeleton, you will see 2 types of girdles. What are the girdles? Girdles are the bony structures that attach the limbs to the trunk. So, for example, this is your upper limb, and this upper limb is attached to the trunk by the pectoral girdle. So this part is connecting the upper limb to the trunk. This part, you see, is connecting the lower limbs to the trunk. This part. So this is the pelvic girdle. So girdles are the bony structures or structures of bones that connect the limbs to the trunk. Make sense? Limb to the trunk. Now, first we'll talk about the pectoral girdles. We have 2 pectoral girdles. One is here, in this side, another is here. Okay? And then we'll talk about the bones of the upper limb. This is the upper limb. So which bones are present in the upper limb. Then we'll talk about the pelvic girdle. We have 1 pelvic girdle that connects both lower limbs to the trunk. This is the only 1 pelvic girdle we have. but we have two pectoral girdles and one pelvic girdle. So we'll see the pelvic girdle and bones of the lower limbs. Then we'll see the differences between male and female pelvic. So if you see the male pelvic and female pelvic, this part, how they are different. Okay. So first, appendicular skeleton consists of, again, the girdles and the bones of the limbs, upper and lower limbs. And pectoral girdle is formed by the clavicle and scapula. So those two bones together form the pectoral girdle. So clavicle in the front and scapula in the back. And pelvic girdle is formed by two hip bones. Two hip bones together form the pelvic girdle. So here in this picture you can see the pectoral girdle. The anterior or front bone is the clavicle, that is the collarbone, and the backbone is the scapula, that is also called shoulder blade. But if I ask you, don't say shoulder blade. Yes, you are now learning anatomy and physiology, so you should not use those terms like shoulder blade or collarbone. Okay? So you should say clavicle and the scapula. Okay? Those two bones together form the pectoral girdle. And in case of female, the clavicle is also called what?
Collarbone.
Collarbone is both male and female. We say collarbone. In female especially, we sometimes say beauty bone. Beauty bone. You see some celebrity, they wear the clothes like you can see the clavicle clearly. Okay, so those are the beauty bones in female. Anyway, so that's the pectoral girdle. So we'll talk about those two pectoral girdle bones first. Clavicle. This is the clavicle, and it has two ends, sternal end and acromial end. So if you see the clavicle in the skeleton, it is a long bone but placed horizontally. Most of the other long bones are placed vertically like this, but this is horizontally placed, and it has two ends. Sternal end, this part attached to the sternum, and acromial end, this part is attached to the acromial process of the scapula. This part of the scapula is called the acromial process. That's why this end is called acromial end. Okay? Scapula. Scapula has three borders: superior border, medial border, and lateral border. And it has three angles: superior angle, inferior angle, and lateral angle. And in the upper lateral corner, it has a number of structures. So, in the upper lateral corner, it has what? A number of structures. We'll see what are those structures. It has a shallow, very shallow cavity that is called glenoid cavity. The head of the humerus the head of the humerus articulates with the glenoid cavity. So this is the glenoid cavity in the scapula, and this is the head of the humerus. Will fit there, okay, and will form the shoulder joint. Will form the shoulder joint. Then, since the glenoid cavity is very shallow, it's not deep, the head of the humerus is not strongly held there because the cavity is shallow. If it is deep, then the head can very nicely, strongly fit there. Since the cavity is shallow, the head of the humerus is not strongly held there. And that's why the shoulder joint displacement occurs very often, because the head can easily get out from that cavity, it is shallow. So if you pull the shoulder like this, if you pull the hand strongly like this, you can displace the head from the cavity. It will come out. And that's why shoulder dislocation, or shoulder dislocation that occurs very often. We'll see in football or soccer, in many sports, that happens very frequently. Then when you see that, you can hold the shoulder like this and try to pull it back. Push and try to pull it back. Don't do that, okay? And the person will sue you. But you can do actually. If you take to the doctor, they will try to put it back, put the head back like this. Okay, so that's the glenoid cavity. Then you have two processes. One is called coracoid process. You see here, if you look here, this is the coracoid process, and this is the acromion. And acromion gets attached to the acromial end of the clavicle. That's why this end is called acromial end, right? So it has two bony structures or processes. One is called the coracoid process. The term coracoid actually came from the beak of the bird. You know bird's beak? So it looks like the beak of the bird. B-E-A-K, beak of the bird. And the acromion. So those are the structures in the upper lateral corner. Now, the scapula has anterior and posterior surfaces because it is a flat triangular shaped bone. It has an anterior surface and a posterior surface. This is the front view. That means you see the anterior surface, and this whole anterior surface is called subscapular fossa. Subscapular fossa. A little bit curved, that's why it's a fossa subscapular. Now this is the back of the scapula, the posterior surface of the scapula. In this surface, you see a bony structure that arises from the back. That bony structure is called the spine. So from the back, a spine arises, and that spine separates the entire posterior surface into, this is the spine that separates the entire posterior surface into upper and lower parts. The upper part is called supraspinous fossa, and the lower part is called infraspinous fossa. That makes 100% sense. Above the spine is supra, below the spine is infra. Okay? So supraspinous and infraspinous fossas are in the back. So how many fossa you see in the scapula? You have seen 3, subscapular in the front, and supraspinous and infraspinous in the back. 3 large muscles get attached to those fossas. In subscapular fossa, the muscle that gets attached, that is called subscapularis. In infraspinous fossa, the muscle gets attached to, that is called infraspinatus, and in supraspinous fossa, the muscle is supraspinatus. I want to ask you this in the lecture exam. Just I'm telling, since the name of the muscles are just exactly the name of the fossa. Subscapularis muscle, supraspinatus muscle, infraspinatus muscle. Those three muscles are attached to this bone, large muscles. Okay, then, so we are done with the pectoral girdle bones. Then we'll talk about the upper limb bones. In each upper limb, you have 30 bones. You have one arm bone. In the arm, you have only one bone, that is the humerus. And in the forearm, you have two long bones. The lateral one, if you are in anatomical position like this, the lateral one is the radius. That means towards your thumb. That's the radius. Always remember the thumb. That's the radius. And the medial one is the ulna. Okay? So in your forearm, you have those two bones. Radius is the lateral one. Ulna is the medial one. If in the test I ask you which one is the lateral bone of the forearm, that's the radius. Okay? Next, in your hand, you have many bones. First, in the most proximal part of the hand, you have short bones. You see the short bones? They form two rows, the proximal row and distal row. Anyway, the short bones, there are 8. In each row, you have 4. So you have 2 rows, that means 8 carpal bones. Those short bones are called carpal bones. Then, next to the carpal bones, you have the metacarpal bones. Metacarpal bones are in your palm, here. So carpal bones here in the wrist, metacarpal bones in the palm. You have 5 metacarpal bones here. So these are carpal short bones, 8, metacarpal 5, and then these are phalangiaces. Phalangiaces are the finger bones. You have total 14 phalangiaces. In your thumb, you have only 2, but in other 4 fingers, you have 3 in each. So 12 and 2, 14. Okay? So those are the bones of your upper limb. Humerus is the largest bone of your upper limb, not in the body. Remember, the largest bone of the upper limb, and located in the arm. It has a shaft and upper and lower ends, like a typical long bone. One shaft and 2 ends. Now, few important structures you need to know are present in the upper end. Which structures are present in the upper end? In the upper end, you have a round head. That head fits in the glenoid cavity, you know that, and form the shoulder joint. Then beyond the head, you have a neck. So neck is just next to the head, around the head. And then, so if you see here, this is the head and this part is the neck. And then you have 2 tubercles. greater and lesser. Greater is the larger one and lesser is the smaller one. Tubercles, you know that, are round structures. And then another structure that is called intertubercular sulcus. Sulcus is an elongated groove in which I told you before, blood vessels or nerves can lie or tendons can lie. So elongated or long groove, that is sulcus. So you see the sulcus in between the tubercles. That's why it is called intertubercular sulcus. Inter means in between the tubercles. Which tubercles? Greater and less. Okay. Another neck is present in the humerus here. So around the head, this neck, you see this is the head, around the head, this neck is called the anatomical neck, and the area where the upper end joined to the shaft, this is the surgical neck. So if I ask you to hold this bone like this, it will stuck here. Loosely hold this bone and drop it, your hand will be stuck here. The bone will stuck here. That's the surgical neck. And around the head, that's the anatomical neck. And why this part is called the surgical neck? Because in most of the cases, fracture of this bone occurs here. That's why this is called the surgical neck of the humerus. Yes?
And you said it's the largest bone, did you say of the upper body or of the
Upper limb.
upper limb? So
Yeah.
the arm? Okay.
Not arm only. This is the upper limb. This is the arm. Okay?
Okay.
Upper limb is this whole part.
Okay.
Okay, so that's the upper end. And if you see the lower end, it also has some important structures. The lower end, you have an articular part. That means that part will form the joint, elbow joint. And that articular part is very shiny and smooth. You can easily tell that this is the articular part because if you see here, it's very shiny and smooth. And this is the articular part, okay? And articular part has two structures. A round structure that is called capitulum and a rectangular structure that is called trochlea. So this, see here, this is the capitulum, that round structure, and this rectangular part is called the trochlea. Okay. Okay. Now, also in the lower end, if you see the front of the lower end, you have two fossas, radial fossa and coronoid fossa. Radial and coronoid fossa. Now, if you see the back, we didn't show the back. Okay. In the back, you have another fossa, that is the larger one. If you see here, this is the back of the lower end of the humerus. The large fossa is there. That is called the olecranon fossa. Okay, olecranon fossa. And in the front, you have how many? How many you have in the front? Two. Okay. Yeah. Why this one is called the radial fossa? Because this is the radius. You see, when you think, it will make sense. This is the radius, right, bone? And when you flex your forearm, bend your forearm, the head of radius will enter into the radial fossa. So this fossa is for the head of the radius. That's why it is called radial fossa. And the ulna, upper end of ulna has two structures. This is called the coronoid process. That's why this fossa is called coronoid fossa. You see what will happen? This is the coronoid process of ulna, and when you flex your forearm, this coronoid process will enter into this fossa. That's why it is called coronoid fossa. And in the back of the ulna apparent, you have the olecranon process. This is the olecranon process, and this is the olecranon fossa. So when you will extend your forearm, make it straight, that olecranon process of ulna will go inside the olecranon fossa. That's why this fossa is called the olecranon fossa. So when you will, in the lab part, you will try to see those, just think why those fossa have been named like that, okay? So that's the lower end of the humerus. There is a test that is done to see if any inflammation or any problem is existed in the shoulder joint or shoulder muscles. What's that test? That test is called the Apley's scratch test. So the patient is asked to scratch the back of the shoulder. How? In two different ways. You will ask the patient to reach to the back of the scapula and scratch there. One is this way, you see the picture like this, and another is going like this to the back. And if you see the person cannot reach there, that tells you that the person has restricted movement. And restricted movement could be due to the problem in the joint or in the muscles. Okay? A couple of clinical conditions related to the shoulder. Dropped shoulder and shoulder dislocation are two different things, remember. Dropped shoulder is not related to the shoulder joint. This is the shoulder joint, you know that, head of the humerus and glenoid cavity, this is the shoulder joint. When the head of the humerus gets out from the glenoid cavity, that is called shoulder dislocation, not dropped shoulder. Okay? Shoulder dislocation. If I pull your hand like this down, that dislocation can occur. The head can come out. That is shoulder dislocation. Now, dropped shoulder is different, which is related to the acromioclavicular joint. You know this joint. This is the clavicle and this is the acromion. So, acromioclavicular joint. If this joint dislocates, then what can happen? This part, whole upper limb will drop down like this. So you will see that one side of the patient is like this. That is called the dropped shoulder.
So it dislocates from the scapula?
Scapula and the clavicle, acromioclavicular joint. The dropped shoulder occurs in acromioclavicular joint, and shoulder dislocation occurs in the shoulder joint. That means glenoid cavity and the head of the humerus. Surgical neck is the location where fracture occurs in most of the time. Okay, bones of the forearm. Forearm has two bones. Lateral one, I'm repeating again. Lateral one is the radius, medial one is the ulna. So you see the radius and the ulna from the front and the back. Now, first you will see the radius. This is the radius, and upper end of radius has a head, and that head of radius is disc shape, round disc. So we can place a DVD or CD nicely on. It's like a round disc. And there is a tuberosity in the upper end of radius, that is called the radial tuberosity. You know, tuberosity is the round bony structure. Okay? And in between the head and the tuberosity, the area is called the neck. So beyond the head is the neck, between the radial tuberosity and the head. Okay? So it has a head, disc shaped, then you have a neck and a radial tuberosity. So just remember those three parts, the upper end. Important, more important for your lab part. So when you see the radius, make sure that you can identify those parts. Okay. Also, in case of humerus or clavicle and scapula, those structures I have mentioned, those are very important for the lab. Okay. So when you see those bones, you will again see those structures. Then the lower end of radius. Lower end of radius has an extended part that's going beyond the main part, going further down, extended part that is going further down from the main part of the bone, that is called the styloid process of radius. So styloid process is nothing but a small bony part that is going beyond the lower end. Main lower end part, it's going beyond that, extended part. Then you see in between the radius and ulna, you have a connective tissue membrane that is called interosseous. Inter means in between, osseous is the bone. So in between the bones, that's the interosseous membrane. Okay, then ulna is the lateral bone. In the upper end of ulna, I have already shown you the parts. If you see the upper end of the ulna, it is like this. You see my hand, like an open mouth of a snake. You have seen the snake, right? So if the snake opens the mouth like this, the upper end of ulna is like this. And now the open mouth has upper jaw and lower jaw. So the upper jaw, this part is called the olecranon process. Okay. Olecranon process. And the lower jaw is called the coronoid process. Did you find them? Coronoid process. And now you remember I showed you the fossa at the lower end of the humerus, olecranon fossa. That means the olecranon process, upper jaw, will go inside the olecranon fossa, and coronoid fossa, this lower jaw, will go inside the coronoid fossa. Okay? So that's why the fossas are called olecranon fossa and coronoid fossa in the lower end of the humerus. Now, in between those two structures, you have the trochlear notch. Remember, notch is U-shaped area. So this is the trochlear notch. And you remember in the lower end of humerus, I showed you in the articular part, you have a round capitulum and a rectangular trochlea. So that rectangular trochlea will fit there. That's why it is called trochlear notch, because trochlea will go inside it. It will fit there. Okay? So when you see those structures, just think that why it is called trochlear notch, because trochlea will go there. Then we will try to find where is the trochlea. Trochlea is in the lower end of the humerus, okay, that rectangular structure. So that's the upper end of the ulna. In the lower end, like radius, you have an extended bony part, tiny bony part is going down further. That is called the styloid process. Again, same name of ulna. styloid process of the alum. Okay. Here you see the capitulum, the trochlea, see the head of the radius, you see the cornoid process and the olecranon process. Okay, so you can see those structures here. Hand. In the hand, you have carpal. Carpal are short bones present in 2 rows. In each row, you have 4 carpal bones. So total, you have 8. And in the wrist area, then in your palm area, in the palm, you have 5 metacarpal and then 14 phalanges. Just know that there are 8 carpal, those are short bones. I won't ask you the name of those 8 carpal, okay? But if you want to learn, you should. Scaphoid, lunate, triquetrum, and pisiform. And then in distal row, trapezium, trapezoid, capitate, and hamate. So those are 8 carpal bones. But I won't ask this in the exam. Okay? Individual names I won't ask. You know that if I show you the short bones of your hand, those are the carpals. So you need to know that these are the carpals, these are the metacarpals, and these are the phalanges. Okay. You see here the carpal, metacarpal, and phalanges. Okay, so we are done with the upper limb bones and pectoral girdle bones. Now we'll see the pelvic girdle. We have one pelvic girdle which is formed by 2 hip bones. 2 hip bones join where? At the symphysis pubis. You remember that piece of fibrocartilage that connects the 2 hip bones. That's the only articulation or joint between 2 hip bones. Symphysis pubis. And the pelvic girdle consists of 2 hip bones. So we'll see the structure of a hip bone. Here you see the pelvic girdle as well as you see the sacrum. Okay, so pelvic girdle is the part formed by 2 hip bones, not the sacrum, remember. So pelvic girdle consists of 2 hip bones only. Now, if you add the sacrum and the pelvic girdle, that means if you add 2 hip bones and the sacrum together, that structure is called the pelvic, that's called the pelvic girdle and bony pelvis. Okay, so sacrum and the girdle together called the bony pelvis. Okay. So this is the picture of a bony pelvis. Now you need to know the parts of a hip bone, important structures of a hip bone. So each hip bone has 3 parts. Although there is no clear demarcation, you can't really see any line or clear border, but developmentally, when the hip bone is formed, when the ossification occurs, 3 ossification centers appear to form this bone. One ossification center appears in the upper part, and other 2 in the lower part. And then from those 3 ossification centers, the formation of bone starts. And that's why we say that this bone has 3 parts. Actually, it is a developmental basis that divides that bone into 3 parts. Okay? So the upper part is called the ilium, and lower front part is called the pubis, and the lower back part is called the ischium. So ilium, ischium, pubis. Those are the 3 parts of the hip bone. And since this bone arises from 3 ossification centers, that's why we divide it into 3 parts. Okay, and you see here they have shown by 3 different colors those 3 parts. Whole upper part, that's the largest part, that is the ilium. Okay, on the top of the ilium, you have a crest that is called the iliac crest. You remember the sharp top part, that is called the crest. So the upper part is called the iliac crest. And in the ilium, you have iliac spines. 2 iliac spines in the front and 2 iliac spines in the back. Those are called iliac spines because they are the parts of the ilium. Spines are the projections. So in the front, in the anterior part of the ilium, you have anterior superior and anterior inferior. Makes sense. Anterior means front and superior is the upper one. So the upper front one, that's the anterior superior. Lower front one, that's the anterior inferior. In the back, we have also 2, posterior superior and posterior inferior. Posterior is the back and superior is above and inferior is below. So just remember that ilium is the upper part of the hip bone and it has a crest, that is the iliac crest, whole upper border, that's the iliac crest, okay? Whole upper border. Then in the front you have 2 spines, anterior superior, anterior inferior. In the back you have 2 spines, posterior superior, posterior inferior. Then if you go to the lower part, lower back part is called the ischium. And there is a rough, round, almost round, not round, kind of round structure, but rough. That structure is called ischial tuberosity. The tuberosity is round and it is rough. And then in the front you have the pubis, and pubis is the part that articulates with the other pubis. So by what? By the cartilage, that fibrocartilage called symphysis pubis. So pubis articulates with the other pubis of another hip bone. Okay, now if I ask you where those 3 parts of the hip bone, ilium, ischium and pubis, finally join. You know that from 3 occipital centers the bone starts to form, and finally they fuse inside the acetabulum. You see 3 colors are meeting inside the acetabulum. What is acetabulum? Acetabulum is the socket. The socket where the head of the femur will fit. And this socket is not like glenoid cavity. not shallow. It is a deep socket, pretty deep, and the head of the femur very nicely, very strongly fits inside that socket, and that's why hip joint is a very strong joint. It is not weak like your shoulder joint. Hip displacement is rare. That should not occur. Okay, so if I ask you that what are the three parts, ilium, ischium, pubis, where they fuse together, where they meet together inside the acetabulum. Acetabulum is what? It's a deep socket. That's the socket that holds the head of the femur. And then if I ask you, show me the iliac crest, show me anterior superior, anterior inferior spines, posterior superior, posterior inferior spines, show me the ischium, show me the ischial tuberosity, and show me the pubis. Show me the symphysis pubis, that cartilage. Okay, what type of cartilage is that? That's the fibrocartilage. Okay, so those are few things you need to remember. Okay. There is one more thing. There is a large opening in this bone that is called obturator foramen. Obturator foramen. If you see the male and female bony pelvises, clearly you can tell which one is male, which one is female bony pelvis. Okay? How you can tell that? You see, these are the bony pelvises. Okay. You know that bony pelvis is formed by the pelvic girdle formed by two hip bones and the sacrum. This is the bony pelvis. Now, this is the male bony pelvis and this is the female. The best way is if you see the pubic arch. This is the pubis, this is the pubis. So two pubises join here, we know that, at symphysis pubis. So if you just see under the symphysis pubis, this angle is called pubic arch. This arch is narrow, much narrower in male than the female. In female you see it's very wide, like more than 45 degrees. Okay? In case of male, you see it's around 20-25 degrees. Okay? So this is male, this is female. That's the best way to identify. There are a few other things. One is, in case of male, this is called the pelvic brim, this opening here. Pelvic brim, P-R-I-M, pelvic brim. And this pelvic brim is much wider in female than the male. You see here, pelvic brim in female is much wider, this opening, and narrower in male. Why? You know that one reason is female pelvic cavity is the location where the fetus grows. Okay, so the uterus gets bigger, so you need more space there. Also, birth canal. You know that the fetus comes out from the body through the birth canal and needs more space here. Okay, and so that is another. Number two, that pelvic brim is much wider in female than the male. Number three, another difference. In case of male, you will see the coccyx. The coccyx are more inwards. That means forward towards your body. And in case of female, the coccyx are more backwards. And that will also ensure more space. It's just, this is a common sense. You think that when the fetus gets out, if the coccyx is forward like this, then that will hit when the baby comes out. A lot of pressure is there. That will hit and break the coccyx. And even the coccyx is more backwards in female. Sometimes the coccyx breaks during the delivery, during the labor. So the coccyx is more backwards in female and more forward in male. So you got 3 differences. That should be enough. If I ask you, tell me a couple of differences between male and female bony pelvises. Those are the differences. One is the pubic arch, another is the pelvic brim, and third one is the coccyx, forward and backward. Okay, so like few days ago, we ordered 2 skeletons, one male and one female for the library, and they were very excited that they got new skeleton, and they took off the covering, plastic covering. Actually on the covering, it was labeled like male and female. And they took off, they did not care when they took off, then they looked the skeleton inside, and then when they wanted to put back, they could not figure out which one is male, which one is female. And they were talking to each other, they called me, something urgent. I said, what happened? Okay, calm down, please. And I went and I saw that few of them are struggling, which one is male and which one is female. You don't need to go close, you can look from far and tell this is male, this is female, right? If you see this pubic arch, you can tell this is male, this is female, okay? So, once you know the things, it's very easy for you in the exam. If you know, it will take a few seconds. If you don't know, you will sit there and minutes you will pass. You won't, be able to answer. So, knowing is very important, okay? For you to be confident, it's very important. If you know, you will feel very confident. Okay. So the bones of the lower limb, the last part. Femur is the largest and longest bone of the body, whole body. Femur is the largest and longest bone of the whole body. And femur is a long bone, only bone in the thigh. If you see the femur, it has an upper and a lower end and a shaft. The upper end, it is also the strongest bone. The upper end has a number of structures. First, it has a round head that fits in the acetabulum of the hip bone and form the hip joint. Then next to the head, you have a long neck. So that's the neck of the femur. And then next to the neck, you have 2 trochanters. Trochanters are irregular bony mass, not round, irregular bony mass, large irregular bony mass. So it has 2 trochanters, the greater trochanter and the lesser trochanter. So if you compare the upper end of the humerus and the upper end of the femur, both have head, both have neck. In case of humerus, you have 2 tubercles, greater and lesser. In case of femur, you have 2 trochanters, not tubercles, greater trochanter and lesser trochanter. Then the trochanters are connected by intertrochanteric crest, okay, that is in the back, and intertrochanteric line that is in the front. So 2 trochanters are connected by a line in the front and a crest in the back. That's all about the upper end. Okay. Then if you see the shaft has a couple of things you need to know. A line, lines are present in some bones. So that line is called linea aspera or aspera line. Linea is the line, linea aspera. Okay, so if I show you in the lab a line in the shaft of the femur and ask you which line is this is the linea aspera. Then the linea aspera, when it goes down, it divides into two lines. So linea aspera is one line in the upper part and middle part. Then when it goes to the bottom part, it divides like this and form two supracondylar lines. Just think that supra means above the condyles. So in the lower end you have two condyles, and since those two lines are above the condyles, those are called supracondylar lines. Last thing in the shaft, you have a foramen that is called the nutrient foramen. They did not show here probably. You see here, this is the nutrient foramen. You remember 3 sets of blood vessels are present in the long bone when we talked about blood vessels in the long bone. The middle one that is going into the shaft, that is called the nutrient blood vessel. So this is the nutrient foramen. When you will go back to the slides, last lecture, nutrient blood vessels. So this foramen is called the nutrient foramen because the nutrient blood vessels pass through it. Okay, so that's the nutrient foramen. Now the lower end of the femur. The lower end of the femur has two large condyles. Condyles are round articular structures. These two condyles form the knee joint, articulates with the tibia and form the knee joint. So two condyles, large round articular structures, those are the condyles. And in between the condyles you have a fossa in the back that is called intercondylar fossa. If you see the back of lower part, you will see the fossa, not in the front. Okay, so in the back you have a fossa that is called the intercondylar fossa. That contains a lot of fat there. But in the lower part, anterior surface of the lower part articulates with the patella, the kneecap, you know that. That's why that surface is called the patellar surface. So in the front of lower part, you have the patellar surface that articulates with the kneecap or patella, and in the back you have intercondylar fossa. That's the fossa in the back. Okay, so that's the femur. Bones of the leg. Your leg has two bones. The medial one is the tibia and the lateral one is the fibula. Tibia is the medial bone. Another important information about tibia and fibula is tibia is much larger than the fibula. Tibia is much stronger than the fibula. Tibia forms the knee joint, not the fibula. Okay? Tibia carries the body weight, not the fibula. So we got few important differences. I'm repeating again. Which one is medial bone? Tibia, very good. And lateral one is the fibula. Which one is the larger one? Tibia. Which one forms the knee joint? Tibia. Which one is the stronger one? Which one carries the or transmits the body weight? Tibia. Okay. So you see tibia performs a number of functions. Fibula does what? Then why fibula is sitting there? Fibula provides attachment to the muscles. So leg muscles, many leg muscles get attached to the fibula. That's the only function of the fibula. Okay? Okay, here you see the tibia and fibula. Now we'll see the upper end of tibia. Upper end of tibia has two condyles, lateral and medial. And you have seen already that lower end of femur also has two condyles. So lower end of femur articulates with the upper end of tibia, because we know that tibia forms the knee joint. And so two condyles of tibia articulates with two condyles of femur of the lower end of, two condyles of femur at the lower end of femur form the knee joint. Okay? And in between two condyles, you have intercondylar eminence, the small bony projection, that is the intercondylar. Inter means in between the condyles, the bony projection, that is called intercondylar eminence. Then another important structure in the upper end of tibia. In the front of the upper end of tibia, you have a tibial tuberosity that actually you can feel. Just touch below the patella. Go below the patella, you see that elevated bony part. That's the tibial tuberosity. Tibial tuberosity provides attachment to the patellar ligament that I'll ask you probably in the exam, particularly in the lab exam. Is important that tibial tuberosity identify. You can easily identify the tibial tuberosity, the rough structure in the upper part of the tibia, the front, and where the patellar ligament gets attached. Okay? Patellar ligament. It's a ligament, comes from the patella. That's why it is called the patellar ligament. So the ligament comes down from the patella. That's the patellar ligament, and that gets attached to the tibial tuberosity. And patellar ligament has a clinical significance. You all know that. Sometimes when you go to the doctor, they will use a small hammer to tap on the patellar ligament below the patella, between patella and the tibial tuberosity. That ligament is there. So if you hit on that and see that your leg shoots forward, kicks forward, that means you are good. Your reflex is there. Okay? So to test the reflex. You are coming now? We are done. We are almost done the lecture. Okay. Now the lower end of tibia has an extended bony part like the radius and ulnar. In case of radius and ulnar, we named them as styloid process. You remember that. In this case, in case of leg bones, same structures, but we name them differently. We say malleolus, okay? But same structure. A small bony part goes beyond the main lower part, extended part. That's the malleolus. Okay? So you have malleoluses in both tibia and fibula. You had styloid processes in both radius, lower end of radius, and ulnar. In case of your forearm bones, those are styloid processes. In case of your leg bones, those are called malleoluses. Okay? In case of tibial malleolus, we say medial because we know that tibia is the medial bone. In case of fibular malleolus, we say lateral malleolus because we know that fibula is the lateral bone of the leg. Okay, then in your foot you have tarsal bones, metatarsal bones, and phalanges. So in case of your articulated hand, in your hand you have seen that carpal bones, metacarpal, and phalanges. In case of your foot you have tarsal, metatarsal, and phalanges. In case of your foot you have 7 tarsal, not 8. In your hand you have seen that you have 8 carpal, right? 4 and 4, 8 carpal. But in case of your foot you have 1 less. You have 7 tarsals. I would ask you the question that which tarsal bone is the largest one? That's the calcaneus. So calcaneus is the largest one. Calcaneus forms the heel of the foot. Okay? So it is also called the heel bone, calcaneus. Second largest one is the talus. So talus is the second largest tarsal bone. Talus does what? Talus articulates with the lower end of tibia, not the calcaneus. Remember the second largest one, talus, that articulates with the lower end of tibia. We know that tibia transmits weight, not the fibula. We have talked about that. So tibia will transmit weight to the talus, not the calcaneus. Then talus will give the weight to the calcaneus, the heel bone, and from there the weight will go to the ground. Okay? So see here how the body weight is transmitted. You already know. I have talked about all those. So your vertebral column, when we talked about the vertebral column, transmits the body weight from the upper part, right? So from the upper part, the weight is transmitted down through the vertebral column. And then from the vertebral column, that weight is given to the pelvic girdle. And from the, that means hip bones. Then pelvic girdle or hip bones will give the weight to the femur. That means to your thigh. That's the only bone. And then from the thigh, the weight is given to the tibia, not to the fibula, right? And tibia will give the weight to the talus, and talus will give the weight to the calcaneus. Calcaneus will give the weight to the ground, to the earth. Okay? So that's how the body weight is traveling, transmitting. Okay? Yes.
Sorry, will you repeat what articulates with the calcaneus and the talus?
Calcaneus is the largest bone, largest tarsal bone. It is called the heel bone. Okay? Talus is the second largest one, and that bone articulates with the lower end of the tibia. So if I ask you that which one articulates with the tibia, that's the talus, not the calcaneus.
Does anything articulate with
Calcaneus?
the fibular?
Fibula articulates with tibia.
Okay.
Okay? So upper and lower ends of fibula articulate with the tibia. Upper and lower end of tibia. If you see here, the upper end of fibula articulates with the upper end of tibia, lower end of fibula articulates with the lower end of tibia. Okay, then so we have 7 tarsal, 5 metatarsal, and 14 phalanges. Again, in case of your big toe, you have 2 phalanges, and in other toes, you have 3 in each. That's why you have total 14. Okay. You know, sometimes girls love to wear high heel like this. Okay. So in that case, normally your foot should be like this, and your calcaneus, the heel bone, should touch the ground. We transmit the weight to the ground, right? That's the normal, how our body is. Your foot is like this. Now, this is the heel bone. Now, if you put a tall heel in your shoe, then your foot is like this. Make sense? Like this. And now, your tibia is like this. Tibia is coming down, and instead of the weight is going from tibia to calcaneus, talus and calcaneus and to the ground. Now your foot is like this, so the weight is going this way. And these bones, your other tarsals, metatarsal, phalanges, those are not designed to transmit weight, but you are telling them to transmit your body weight because it's going like this. So that can cause a lot of friction and eventually pain or inflammation in the joints in late life. Okay? But don't stop wearing. Fashion is also important. Okay. So do you have any questions? No question?
So the metatarsals are numbered from the inside out. So one would be the one that goes in line with your big toe and then.
Yes, yes. We count from big toe, okay? Number 1, 2, 3, 4, 5. Yeah.
And then same with the.
Yeah.
Okay.
In your hand.
Okay.
Okay. So in the lab exam, if I put these two, which one is male or one? Is it a male or female? You should not have problem, right? So now we'll have a break of 10 minutes, then we'll start the lab. Okay.